The way to describe what Dr. Mohrdar has to offer is everyone has a choice. You can either follow a allopathic, regular doctor approach, or you can follow a homeopathic approach. If you follow the allopathic, well then you have the availability of having your health care provided by insurance. However, it's not health care. What it is, it's an extension of the pharmaceuticals. It's pretty well known that the medical establishment is driven by money. Dr. Mohrdar and the homeopathic community are driven by the desire for people to become healthy. Dr. Mohrdar is the only homeopath that I've personally seen. My wife has seen another one out of the Scripps Institute, but he was unsuccessful in addressing her issues. In my case, what I experienced after 29 years in corporate business, I was suffering from stress. But the way in which stress manifested itself on the allopathic, regular doctors would have immediately given me cholesterol medicine, they would have given me blood pressure medicine, and then ultimately medicine for the prostate, such as Proscar. Upon a complete physical, more complete than I'd ever received from normal doctors or the mainstream doctors, Dr. Mohrdar didn't look for addressing symptoms, he looked for the cause. As a result of treating the cause, I immediately regained what I would call normalcy as far as, one, I understood why my body was functioning the way it was, what the stress of 29 years in corporate business had done to me, and then he very clearly explained how he was going to address the cause versus the symptom, which in my case was cleaning of the liver, addressing the adrenal system, which was shot. He also found the beginning of a prostate issue, which my last allopathic doctor didn't even do a digital exam on, and at that time I was right at 50, and this is unconscionable for a doctor, a mainstream doctor, to perform a physical and overlook the prostate in the case of a male. Dr. Mohrdar, his technique is very specific. You can tell him what you think the issues are, but what he's most interested in who you are through the blood. Through the blood, he will be able to diagnose and understand completely how your body is working against itself, what might be a condition, what might be an alien issue as far as bacterial, if it's viral, or if it's organic within organs, and he addresses it in a very understandable manner. He spends the time with you. There is none of this waiting in between pharmaceutical reps to get a quick 15-minute visit and then you're billed for. Not the case. Dr. Mohrdar will spend all the time required to address you as an individual and your cause of the illness. Now, I'm going to wrap it up, put it succinctly in this manner as far as what you might expect if you were to choose the homeopathic way. One, there's no side effects from anything that you receive from Dr. Mohrdar because there's nothing toxic that you'll ever take. Second, you will not have instant cure or instant relief necessarily of your symptom because he's not addressing it through traditional drugs. What he is going to do is enable your body to heal itself, which may take a little longer. But the illness you might be experiencing now didn't occur either overnight. It took a while for that to develop. And you may not have known the initial stages of it, and as you become aware in the final stages of it took a while to get to where you're at. So I would strongly encourage you to pursue Dr. Mohrdar or a homeopathic approach. At this point, I would put him at the top of the esteem level when it comes to the profession itself. And once you get to know Dr. Mohrdar and the hours he puts into his profession, I think you'll be humbled by how seriously he takes his profession as well as he'll take care of you.